And thank you. Hello, and welcome to another Rush Generations Health Education lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, July 2nd. I am Grisel Rodriguez Morales, and I'll be your moderator for today's lecture, Maintaining Independence through prevention, which at times is thanks to rush generations. But yes, maintaining independence through prevention. Before I present to you the wonderful speakers joining us today, I'd like to first thank our Rush Generations lecture producer, Hannah Whiteman, as always, doing a fabulous job with the production of this lecture, helping us manage the chat, as well as other key aspects, so that we can have a great conversation. Please use your chat. We want to know also not only about the information that our speakers are providing today, but also some of the things that you may want to know about or suggest to remain independent as you age. Today we're going to be talking about the different ways that we can maintain our independence, ways that can be supported by a variety of community programs that you will be hearing about from our speakers very soon. As always, we are live streaming this lecture via our YouTube channel using the video platform Zoom, which allows us to host a good number of people who join us via phone. Thank you so much, all of you, for joining us. For those of you on YouTube, we ask that you please use the chat function to ask questions. And as I said, to add to the discussion, to add comments throughout the lecture. We will make sure that your comments and the questions make it to the presenters. And for those of you listening to the discussion just via audio, you also have an opportunity at the end of the presentation to unmute your audio so that you can ask your questions. As always, we'd like to remind you that all the information that we offer here is for your benefit, for general purposes, informational purposes only, and for anything that is very specific that it requires another level of expertise, you seek additional advice, professional advice for others, for those situations that are quite specific to you and your needs. In terms of today's topic, we know that having access to age-friendly environments, as well as having financial, psychological, and social support, those are some of the factors that contribute positively to the independence of older people, excuse me. And with Independence Day coming up, this was a great way for us to segue and talk about independence. You know, interventions, programs, services that seek to facilitate care whenever it's accessible, or interventions, programs, services that seek to change the physical and the social environment, or that include education or counseling. You know, this topic about independence is enormous. So we are very grateful to have two dear Rush colleagues joining us today for information and ideas that could be helpful to those wanting to keep their independence as they age. So without further ado, let me just introduce, first of all, we'll have Emma Merka. I knew that I was going to do that. But Emma is a licensed social worker and joined the Department of Social Work and Community Health at Rush University Medical Center in March 2024. Emma brings valuable experience from her previous roles as a care manager with the Illinois Department on Aging's Community Care Program, and as an elder care specialist within the employee assistance programs. At Rush, with our department, she provides social work support for the older adult home modification program and offers services twice a month at the Austin Senior Center, one of the senior centers here in the city that we offer clinical services in. Emma's work focuses on enhancing the well-being and independence of older adults through comprehensive care, coordination, and community-based support. Then we'll hear from Danelia Mitchum, a clinical social worker and certified health education specialist, also for Rush University Medical Center, Departments of Social Work and Community Health. Danelia received a Master of Social Work degree and a Bachelor's in Science in Community Health from the University of Illinois at Urbana-Champaign. And at Rush, she provides clinical care management, as well as overseeing the integration of social work, nursing, pharmacy, and nutrition services into those senior centers that I just mentioned, 6 of the City of Chicago senior centers. She also facilitates educational and support groups and is the program coordinator for the Health Legacy Program for Women, where she oversees the implementation of the community-based intervention to improve the health of women of color in the West Side of Chicago. So as you see, great experience, great colleagues. It is a pleasure to have them both here. So I'll hand it the screen, I was gonna say the floor, to Emma.
Great. Hi. Hopefully everyone can hear me okay and see me okay. Thank you so much for that lovely introduction. I'm so excited to be here today to talk about the Rush Older Adult Home Modification Program. We are just about to kick off the second round of this program later this summer. So I think it's a great opportunity to discuss what this program entails and hopefully entice some of you to participate, especially if you are someone that does want to maintain their independence in the community and in the home. I think this program aligns great for the theme of our lecture today. So thank you so much. You can go to the next slide. So I'll jump a little bit here back to my introduction and background. So I joined Rush in March 2024. I've worked in a lot of different spaces with older adults, both on a micro and macro level. I've worked as a care manager with the Illinois Department on Aging Community Care Program, so helping older adults get enrolled in homemaker services and home delivered meals living in the city, as well as an elder care specialist for one of the largest employee assistance programs in the US, covering elder care support all throughout the 50 states of the US. But I'm most familiar with resources and support for older adults in the city of Chicago. I'm very happy to be at the Austin Senior Center twice a month. The second and fourth Tuesdays, you can find me there for drop-in social work services. And I am the social worker with Rush for the Older Adult Home Modification Program in the second round, which will be the focus of my presentation for today. Okay, you can go next slide. So what is the Rush Older Adult Home Modification Program? This program was created through a HUD grant to help older adults on the west side of Chicago age in place. The team includes an occupational therapist, a home repair specialist, and social worker, myself. The intervention is delivered in 4 sessions. So what that will look like is the social worker doing a comprehensive intake eligibility screen with the interested prospective client, determining that they do meet the eligibility criteria, and then scheduling an in-home assessment for the next session. That session will be with the occupational therapist, who will do a comprehensive overview of the home, looking for areas where home modification and durable medical equipment would be most appropriate and helpful. They will also be looking at zones of the house that are more hazardous, areas that pose more dangerous zones for older adults who might be at risk of injuring themselves, and coming up with a plan of attack for the home repair specialist. The subsequent sessions will be the home repair specialists and contractors who are coming out and actually doing the home modification and renovations. So this program covers up to $5,000 in home modification and durable medical equipment costs. It's really up to the occupational therapist and home repair specialist to determine what zone of the home is most needed with the home modification. They do take into consideration what areas you would like to be fixed or modified. However, they bring their expertise into this in-home assessment to determine what is really most appropriate for that person and on a case-by-case basis. So, what are the eligibility criteria for this program? Adults must be 62 years or older, live in the West Side neighborhoods of Chicago and West Suburban Cook County. You can either be a homeowner or a renter. If you are a renter, the team will work with your building management or landlord to come up with a plan and agreement to make the modification happen. We're really excited this next round to include renters in our pool of candidates, essentially opening up much more opportunity for home modification, as we were previously just limited to homeowners. So this next iteration of the program will be available to renters. So next slide. So you might be asking yourself, what is aging in place? This is a concept that you might have heard before, but it's really what is driving our work behind this program. So I want to be clear about laying out the definition so folks have a sense of really what grounds us in the work that we're doing to make this home modification happen and to make people live safer in their residence. So the definition of the concept of aging in place is it refers to the ability of older adults to remain in their own homes and communities safely, independently, and comfortably, regardless of age, income, or ability level. So I just want everyone to kind of keep that in the back of their mind as I'm going over the program. Next slide. So, why is aging in place important? I'm a social worker, so I thought I would bring this topic up through a social work perspective. There are a lot of reasons why aging in place is important. First off, it promotes autonomy and dignity. It supports older adults' right to self-determination. If it's their goal to stay in the home as long as possible, then this home modification will assist in that goal. It also honors cultural and personal preferences. It enhances the quality of life. It reduces isolation through community engagement. It maintains familiar routines and environments, which are so important to people. It also reduces institutionalization, so it prevents premature entry into facilities like nursing homes or hospitals. It also decreases public health system burden. It also supports family systems. It encourages family-based caregiving models and offers social workers opportunities to support caregivers who feel driven to assist their family members as long as possible in the home. And then finally, it integrates holistic services. So it helps bring together multiple pieces such as housing, health, mental health, and social services all under one roof. And lastly, it advocates for policies that support home and community-based services, which is very important in our day and age as we see a larger group of older adults in our population. Next slide. So the way we've looked at this program, the Older Adult Home Modification Program, is through 3 different initiatives. So I've broken down these initiatives into the 3 categories: modifications, equipment, and strategies. So with modifications, there's a lot of different tactics and tools that you can implement yourself or also through this program. But I wanted to give folks an idea of some of the things that they could do or consider or bring to the table if they do move forward with this program. So what modifications can you do to help maintain your independence? You can add lighting above exterior doors, threshold installation and repair, accessible shelving and closet rods, tub, shower, and toilet grab bars, comfort height toilets, stair railings with returns, handheld shower heads, and smart doorbells. Smart doorbells are doorbells that have a talking function and a camera function, so you can see who's outside of your home and also communicate with them too. You'll notice here in this slide and the next couple slides with these other initiatives, a lot of these modifications and tools target the bathroom. Over 80% of falls that occur in the home are in the bathroom. This home modification program through Rush largely tackles modifications in the bathroom, given that there are many fall risks there. So they'll work with folks to install things that make it safer to do your daily routine, as well as give you tips and tricks about what you can do yourself to make it safer. Next slide. So equipment. What are some equipment that you can get? Smart night lights, tub benches and shower chairs, raised toilet seat and rails, anti-slip strips for stairs and tubs, insertable bed rails, furniture risers, pull chain fan extensions, and walker trays. You know, all of these give you an idea of what the home modification can help with, or, you know, give you ideas of what you can purchase on your own to help maintain that independence. This is just an example too. There's many more out there than what you see on the slide. I just wanted to give folks a sense of what modifications are out there and equipment and then strategies. So we can jump to the next slide for that. So strategies, what can you actually do? You can tape down or remove drop rugs, clearing cords and clutter away from pathways, removing box spring if bed is too high, relocating most access items in kitchen to accessible areas. You might be someone who frequently uses their crock pot. Rather than putting it up in a cabinet high above the sink or in a cabinet below, maybe consider having it out on your kitchen counter. I know kitchen counter space is valuable, precious space. However, think about what it could do for you rather than having to strain your back every time reaching up for it in a cabinet or down below, rather than just having it out on the counter for easy convenience. Also, removing items from stairways and changing light bulbs. Okay, we can go to the next slide. So I have included some images here for folks on the phone. I will just give a brief description. So we have here some rug pads, a cart that you can wheel. This is much more safer for older adults who carry groceries, having it all in one centralized place on wheels. And then the third image is a portable shower head that you can move to yourself rather than having it be stationary up to the wall where you have to get yourself closer to the shower head. This way you can bring it down closer to you, thus creating a more safer environment in the home, especially in the shower where many falls take place. Next slide. Here are some other images too. The image on the far left is for outlets that you can plug into the wall, where multiple outlets could be plugged at once, or multiple plugs could be used at one time. The other image we have are clear burners on your stove, or knobs for your stove, excuse me, where it's easier to gauge the level of gas that you have for your stove. It's more clearly labeled with a clear knob. And then lastly, we have a temperature reader that has a clear number visible, rather than one that you have to dial yourself and read. This has a large number displayed. So I just wanted to include these images so folks can kind of put an image to a concept with home modifications that help sustain independence. Next slide. So where does my role fit into this older adult home modification program? So I will be doing the intake eligibility assessments with those who are interested, making sure that they meet the criteria as well as other functional needs. This program may not cover everything you need in the home. There may be unmet needs, and that's where I come into play to help identify other community resources, as well as other programs or services that might benefit that person or their family member. Collaboration. I'm also working with the staff to determine if this person's appropriate, how we can best implement this program through their caregivers and other strategies. Education, empowering clients and caregivers on options and benefits. Again, going back to if the home modification program does not cover everything, letting them know there are still other options out there. There are still other funding sources that we can tap into to help make sure that your home is as safe as it can be. Advocacy, navigating funding sources and addressing systemic barriers. Again, the options are limited, but they are out there, and we want to make sure that folks are tapping into as many pools of resources as they possibly can if their goal is to age in place and stay in the home for as long as possible. And then lastly, care management. So connection to additional community-based supports and resources. Okay, next slide. This is another list. It's very small, so apologies if it's hard to read, but it does give another list of ideas of home safety recommendations. So keeping items off of stairs, marking uneven thresholds with contrasting tape or paint, keeping pet accessories out of walkways, placing adhesive slip treads on shower and bathtub floors. If you must use a step stool, buy one with safety bar to hold on to. So I just wanted to give some other ideas of home safety recommendations that we also take into consideration. So tools and resources. These are other bodies of work and resources that you can tap into. Capable Model through the Johns Hopkins Institute, Rebuilding Together, which offers free home repair for low-income seniors, the Area Agency on Aging, the AARP Home Fit Guide, and home safety assessments. Next slide. So, are you interested in the older adult home modification program for you or someone else? For our round 2, we do encourage folks to call 312-942 6400 to be added to the wait list. We do anticipate this program starting up at the end of this summer. If you have specific questions, I'm happy to answer them now in this space or offline and connect at a later point. If you have specific questions about modification, I would have to go back to the team and see what they say, but happy to be available now to support as needed. So thank you guys so much for this time. And I was happy to share more about the program, and hopefully we got some folks interested in it. So thank you so much.
Thank you. Thank you. There's a question in terms of the AAA. That refers to the Area Agency on Aging, right? And what is it exactly that they do?
So the Area Agency on Aging is a organization that serves older adults, and it's an umbrella agency. So there's a lot of different programs that trickle down under it that they offer, including Medicare counseling, help with home delivered meals, connection to homemaker services, funding opportunities. Their goal and work is oftentimes too driven by helping people age in place. So the Area Agency on Aging would be a good organization to reach out to for any ideas or other resources that they may know of for funding for home modification.
Yes. So even though we are referring right now to this program that is available in our area, if people are interested in not only home modification program, but any program that will foster or support their independence, that's a great resource. That's a great resource for people to tap into. All right. Also, can you we'll show it again well, let's do that now. If you wouldn't mind, I think have someone from YouTube asking that the last slide is shown again near the end. It went very quickly. Something also, all these lectures, please know that they are recorded. You can always, rewind a little, even freeze and pause, not freeze. And then that way you have some information that you can tap into. So the capable mother, I don't think there was any question in particular about any of that, or other than oh, I thought it was the AAA, so maybe it is the AARP. But okay. Can you say a little bit more about the AARP? Is that a similar program also, like the home modification, because it's home fit, or is a guide?
The AARP Home Fit Guide is like a self-guided tool that you would access online for that identifies like potential dangerous zones or hazardous zones in your home. Okay. And offers ideas about how you can remedy that or modifications that you can implement. So that would be just something that folks could look up online for the AARP Home Fit Guide.
This is great. It fits with what we started the conversation about: education, counseling, all of this. There's resources that we hope that you feel comfortable approaching and getting more information about, so that you can remain independent. So we'll have also a Q&A at the end. Maybe we can bring in Danilia Mitchen at this point, and if more questions arise about Emma's portion, we can go into that.
Thank you.
Thank you. Hi, Danilia.
Hi, Grizel. Thank you. Hello, everyone. My name is Danelia. As Grizel mentioned, I'm a licensed clinical social worker and certified health education specialist with Rush Generations. I also coordinate our health promotion services within the senior centers throughout the city of Chicago. And I want to highlight, as we are discussing maintaining and just continuing to work through prevention measures to maintain independence. So that's what I will focus on today. Next slide, please. So for those of you who do not know, and you may see the acronym CDFSS or DFSS. In general, it's just the Department of Family and Supportive Services. The C is Chicago, so you may see CDFSS some places and DFSS some places, but they're one and the same. So the Senior Services Division is one of 7 program areas within DFSS. So working in collaboration with Aging Network partners, the Senior Services Division's efforts are guided by 1, supporting older persons to live independently in their own communities and homes for as long as possible. I know Emma mentioned that a little bit. 2, ensuring that those who reside in institutions are treated with dignity and care. And 3, guaranteeing that older persons have access to accurate information to participate in public policy. So there are 21 senior centers that are uniquely positioned across the city of Chicago to address health inequities. And they have about 500,000 annual visits to each center, serving over 30,000 older adults per year. So people are utilizing the services. So to become eligible for utilizing these services, you have to be 55 and older or have a disability. Each center is a little different, so I encourage you to just give them a call in terms of eligibility and age criteria. And these programs are offered also online and telephonically. Next slide, please. And I know this is a little small, I apologize, but I wanted you to get an idea of the type of services that are offered at the senior centers. So together with service providers, the centers offer vital information and assistance, congregate and home delivered meals, senior centers, of course, fitness classes, caregiver support services, in-home services, employment and training, and volunteer opportunities, elder rights programs, health promotions, and access to benefits. They continually innovate and advocate for residents so that they continue to thrive as they are aging in place. They value integrity and respect and promote social engagement among the older adult population. And as an antidote to dependence, social isolation, and withdrawal. A few other things that are offered within the center are evidence-based workshops, poetry classes, insurance webinars, flood, long-term care, and health coverage. The list goes on and on. Each center is a little different in terms of services, but you can, throughout the 21 services, you can find some of these services in most places. Next slide, please. So here we have the Chicago Seniors Connected brochure that is produced on a quarterly basis and provides the programs that we have telephonically, as well as some of the in-person programming that is happening at the centers. You can pick up a copy at your local senior center. If you are on social media, they have a Facebook page, a Twitter page, an X page. So they're all over social media if you want to find more information. You can also email seniors online at cityofchicago.org. And they also have a hotline as well that you can call for more information. Next slide, please. So I want to talk a little bit about the health promotion and wellness team that we bring in. You may see a familiar face. There's Emma. But our team consists of social work, nursing, dietitian, and pharmacy. If you are visiting your local senior centers, you may see some of us. You may know some of us, and if you have not visited, we encourage you to visit. Next slide, please. And this is also the rest of our team. Next slide. So as I mentioned, there's 21 locations, 21 senior center locations across the city of Chicago. Rush Generations, we are currently covering 6 of those centers. So the 6 centers are Westtown Senior Center, Kelvin Park Senior Center, Austin, Central West, Southeast, and Southwest Senior Center. So that is where we are currently located, providing those services that I mentioned. Next slide. So you may be wondering what happens at the senior centers. So we have wellness nurses. The nurses are knowledgeable about health issues and provide education, guidance, and insight. You can get your blood pressure checked, other health screenings, glucose. We have monthly health talks as well to help manage your health. In terms of social working, we are helping to identify your wellness goals and resources for your daily life. So that also could include living independently in your home or coping with stress, caring for others, emotional, social, financial, and spiritual health. So we are looking at a host of different topics. The dietitian will assist you in achieving your nutritional goals. You can meet with our dietitian one-on-one to talk about your specific nutrition goals and dietary needs and strategies that will help you to maintain a positive lifestyle change, and also the relationship between nutrition and your health. And then we have pharmacists. Pharmacists provides presentations around medication, health-related issues. You can also make an appointment to see a pharmacist one-on-one for a brown bag where you bring in your medications and they review your medications and just really assist with medication management. So the goals of the health promotion services for older adults consist of increasing health awareness, increasing self-determination in managing their health, and increasing positive health behaviors. So we're always looking at these metrics when we're providing services. Next slide, please. So I wanted to share a few of our survey results. We have a survey that we distribute yearly to the clients we see within the senior centers to see how we're doing. So overall, what you see here, the question was how many times you participated in a nursing, social work, pharmacy, or evidence-based program at the center. You may see the red and green, which it doesn't really matter at this point, but red is our partners, White Crane, who are also providing these services in the other senior centers that we discuss. So overall, you can see that that people are continually utilizing our services on a multiple basis. And next slide. So we also want to rate the health and wellness program overall, right? We want to make sure it's working. So this is important to make sure we are effective in delivering materials in a useful way so that you can maintain your independence and what matters to you. So we are constantly making sure that we are meeting standards. And as you can see, people are enjoying the programs that we offer. Next slide, thank you. And this question is really important that we ask. So an overwhelming majority, 92% of participants stated that their confidence in caring for their overall health improved as a result of the program. So this is great because confidence in caring for their overall health is another prevention measure for maintaining your independence. Next slide, please. And these are just other prevention measures and factors that also support independent living. So I have learned more about my health. I have learned how to prevent future complications, better understanding healthy food choices, better understanding of my medications, better able to manage my health. Next slide. Spoke to my healthcare provider about my health, made changes to my diet or eating habits, reviewed all of my medications, socialized more inside and outside of the center, increased my physical activity. So again, these are prevention measures that supports independent living, and you can see that this support is taking place in the senior centers across the city. Thank you. Now, I know sometimes information can be overwhelming, so you may be thinking where to start. You may not need any specific support at this time, but I just encourage you to visit your local senior center, and they can help you access services that you may need. And if they need to refer you to a different location, they can do so as well. We also have Senior Fest coming up, which is a great event that we have yearly for seniors. We have this event taking place on Thursday, August 21st at Millennium Park, and that's from 9 a.m. to 2 p.m. So if you are also wondering about the type of services that we're offering and get to meet all of the providers and things of that nature, this will be a great place to visit if you are able to do so. And this is my information in the event that you want to call and get more information about the senior centers, or if you have just any general questions. Thank you.
All right, thank you so much. I think Emma can join us now. There's a lot of activity, not only through the YouTube channel, but also sometimes I get some questions through text as well. So bear with me because I'm trying to manage it all. But one question that I wanted to clarify at the beginning, when Emma was saying about 5K, that means that is $5,000 up to $5,000 that the program covers in home modification, whatever is needed. So thank you for that. And then in terms of the strategies, again, as I said, maybe we can go back a little bit and then offer some of the strategies that were in the slide, but also strategies. If I were to do a fire Q&A or something, what are some of the strategies for people to stay independent? So for me, for example, comes to mind immediately, make sure that you know which medications you're taking and you always know when is it that you have to replenish them, especially good communication with whatever pharmacist you're using. So that's one always that I know that is key for us, making sure that people have their medication always available. So medication management.
Yeah, I would also say having a list of emergency contacts on your fridge. If you have a primary caregiver, if you are enrolled in the community care program and have like a hired caregiver through the Department on Aging, their contact information, making sure that everything is clearly labeled and on display. I know people tend to put things on their fridge because that's an easy access point where information is usually stored. I would recommend that as well. Getting, things in the home such as the smart doorbell, shower seats, and grab bars. Again, going back to putting anti-slip treads on shower and bathtub floors, replacing knob style doors and faucet handles with lever style handles. A lot of older adults tend to get arthritis in their hands, and turning knobs in a circular way can be difficult. So even changing knobs to handles so it's easier to grip is another idea. Things to think about that, could be discussed and implemented through the older adult home modification program. And I think Griselle said this video will be on YouTube, so feel free to reference that more exhaustive list of ideas and strategies in my presentation that you can do too.
So, Emma, I was just going to add to that. I know it's a little different, but what I see also too at the senior centers, when my clients talk about this, we also talk about the shoes that they're wearing in home. So sometimes we're wearing like different house shoes, or very stylish house shoes, which don't have a really good grip on them. So making sure that you have the appropriate footwear as you're walking around the home to prevent falls.
Yeah.
I second that. And then also just wanted to throw in there too, night lights, especially if you are someone who has low vision. There are smart night lights too that become activated when they're motion censored. So when you walk by, they'll light up. If you're someone who's bothered by having a bright light on all night, consider getting a smart night light that's motion activated, so it's not glaring in your face all night long. But I also second getting appropriate shoes that grip around your feet and don't drag.
Okay, and I like the suggestion about having contact information. Know who to call, and in terms of strategies, making sure that your home, that your environment is working for you. So may have things that are all the way to the roof, but you don't need them. So, or maybe that's for somebody when they can probably help you or things like that. So there's a very good question. I mean, we talk a lot about the criteria and eligibility and all of that. And at times that is in terms of financial eligibility and in terms of mobility, in terms of what is it that the program is about, if it's for people with specific conditions. So that can be frustrating, but there's a purpose. Why is it in a certain area, or why is it that is for a certain financial threshold and things like that. That is at least the programs that are available in that particular area. However, I once again going back to the Area Agency on Aging, that's a great resource for people to call and see if you're in another part of the state or if you're in another state, because at times we hear that people visit our YouTube channel and consume the information, but maybe it's not available. This particular program will not be available to you, but in that area. However, it's always good to ask. If you can always say, I heard about this program being available in Chicago, in the west side of Chicago, if there's something similar, because I am finding myself in need of similar assistance and all of that. But the question is, why aren't these services available to seniors in need? So for someone that is not necessarily based in Chicago, so is seniors in need, but not based on where you live. So I have addressed it. Anything you would like to add to that? If it's not necessarily for someone that is in the west side of Chicago, for example. Is that the case for the home modification program is in the west side of Chicago?
The home modification program does target west side neighborhoods of Chicago and suburban Cook County on the west side specifically. However, I just want to let folks know that if you live in another area of Chicago and you're looking for care management support, or if you have social care goals, such as finding a doctor, getting connected to a support group, or in-home support, financial assistance resources for rent or utility or food programs, we can still serve you as a community practice patient. So I work with folks outside of the older adult home modification program for care management and support, and there's no boundaries or zip codes or demographic criteria to qualify for care management that myself and my team is a part of. If you are connected to Rush with a doctor or clinic that you go to regularly, we would refer you to that social worker within that clinic and that department. But if you're just a community member looking for support or have social care goals, we would be more than happy to step in and assist. I would say that the best way to get connected for care management support, if you don't live in the west side, or even if you do live in the west side, is to call the Swatch Community 800 helpline number, which
Yes.
I'd be happy to share now, or should I give it over
It's,
the
it's
video?
our helpline number, so thank you. Yeah, I'm glad you're mentioning that because yes, at the end of this presentations, when we talked about all the programs that are coming up for Rush Generations, that 1-800 number that we always give you to register for our programs, know that that's also the number that you can call and say, hey, and the better if you say, I heard that Emma who presented, or Danilia presented at the Rush Generations lecture, we can talk to a social worker, and this is the need, or this is what I would like, I'm exploring, this is the question that I have, so that they have an idea about if it requires, it's not a hotline, it's a helpline. So, but it's always helpful to have a little bit more information so that we know who to send you. The same goes for another question in terms of low vision for individuals with low vision. I do know that here in Chicago, we have a great organization, the Chicago Lighthouse. I don't know if both of you know of any others. But again, if you don't know exactly who to contact, you can always call that 1-800-757-0202. That's the number that we use for our registration. One of our agents, and at the beginning you can say, this is for Rush Generations, but also in this case, if it's questions for social care or social work, you can select that option, and then you go into that agent or pool of agents. And if they cannot pick up live, you always can leave a voicemail, and they return your call very soon. So thank you for that. Let's see. I'm wondering also maybe at the end, even for those, I know that just this morning, Danilia, you were sending the brochure of everything that is coming up for July, August, right? June, July, and August. Well, now for June and July. I'm sorry, now for July and August, all the programs, and it covers a great deal of material and programs and services.
Yes, it covers the in-person programs. It gives a little background about the senior centers, what is happening at the local senior center. So whether it's a food giveaway, whether they're having a celebration, whether they're having special topics, those things are listed in that brochure. Also, resources just throughout the city of Chicago for older adults are listed in there. So, for example, we are in the summer months, so they have an article about staying cool in the summer, fighting dehydration. things of that nature. And then also our online programming. So if you can't get out to the centers, you can participate online, and you can also participate through telephone.
Thank you so much. And I'm so sorry for our colors. I missed giving the option. So if you would have a question for our speakers, just press the *6 and we'll make sure they answer your questions. And if not, I wanted to close us by going back. I'm so glad that both of you talked about empowerment. Emma talked about self-determination. Those are key. Feel empowered and don't hesitate to reach out. Those of us that are doing this work, not only in terms of healthcare, but also serving older adults, that's what we are here for and what we would like to promote. But in terms of self-determination, just recently I was reading an article in which actually it says that independence among older people, or they say among the elderly, is defined as the degree of individual autonomy in meeting their daily needs, like eating, dressing up, showering, and all of that, and their right to choose. So that's your right. I hope that helps you feel empowered to reach out and to explore these services. And again, our toll-free line, our toll-free numbers, helpline is 1-800-757-0202. I think that is great. Thank you so much to both of you. I hope that people feel empowered to explore services at the senior centers, also that they don't hesitate to participate in our Rush Generations programs, also to send this information to others and to always review back. And there's information there that can give you ideas about how to stay. And also ultimately, which is what I think that's my mantra for this year, is connection, connection, connection. Stay connected to others. Make sure that you are not socially isolated. And it doesn't have to be a whole village. At least one person is all what it takes for you to be connected to someone that you can rely on or mutually rely on, so that you can remain independent. So thank you, Emma. Thank you, Danilia. I think that we can transition into what we're gonna be bringing for the next programs. Let's see. I know that Hannah sent that to me very early. Excellent. Yes. Learning to live well with chronic pain. So learning to live well with chronic pain is a excuse me, 6-week workshop for people living with chronic pain. And the participants in this program engage in discussions and skill building activities to better cope with the day-to-day management of chronic pain. All the sessions incorporate an exercise element, as well as strategies for medication management, pacing activity and rest, and other materials and other topics. So the next workshop that we're gonna be offering here at Rush on our main campus starts on Wednesdays, on Wednesday, July 23rd through August 27th, from 2 to 4:30. Believe me, those several weeks sessions go by very quickly. So join us. If you are dealing with chronic pain, feel free to give us a call, 1-800-757-0202, for more information and or to register. Similarly, we have mentioned also falls or falls prevention. And so Matter of Balance is an 8-week or an 8-session workshop for individuals who have begun to restrict their physical or social activity because they have developed a fear of falling. The workshop uses problem solving, confidence building, and balance improvement exercise, as well as cognitive restructuring to help participants prevent falls, improve their balance, and regain the ability to do what is most important to them. The next workshop will be held here on campus, the Rush campus, on Tuesdays and Thursdays starting August 5th through August 28th from 1 to 3 p.m. Then Shaman Senior Voices, which aims to empower older adults to discuss what matters most to them as they age, is available to you. So don't feel free to share what matters most to you with us, and then that's a video that you can share with your physician, with your loved ones. We want to hear from you. So consider sharing your wisdom on why it is important for your healthcare team and for your loved ones to know your goals, your wishes, and what matters most to you. You can scan that QR code and it will take you directly into the platform to record a video. Excuse me. Our next lecture is going to be on July 23rd, and it's titled Holistic Approaches to Health, 1 o'clock once again. So we hope to see you there. For now, please remember the toll-free number 1-800-757-0202 for more information about our program, or to get in contact with Emilia or Emma or other social workers in the Department of Social Work and Community Health at Rush University Medical Center. That is a service not only to patients, it's a service to the community. So feel free to always give us a call, and we will make sure that someone gets to you and your concerns, and we will assist. Thank you so much.